Hello, everyone. Today I have a really important story to share with you. Have you been reassured just by looking at your fasting blood sugar levels from a health checkup? If so, please watch this video until the end. What I'm about to tell you today could save your life. Now let's start with a shocking fact. Many of you might think fasting blood sugar is all that matters, but recent medical research is increasingly emphasizing the importance of post-meal blood sugar management. I'll explain why today. A lot of people believe that if their fasting blood sugar is normal, everything is fine. This can be a dangerous misconception. Why? Because most of the time we're awake. We're in a post-meal state. Out of 24 hours in a day, how much time are we truly fasting? Just a few hours. Here's another surprising fact. Recent studies show that even if fasting blood sugar is normal, people with high post-meal blood sugar have double the risk of dying from cardiovascular disease. This is the hidden truth about diabetes. So let's dive into fasting blood sugar first. Fasting blood sugar is measured after not eating for at least 8 hours. The normal range is 70 to 100. 100 to 125 indicates prediabetes, and 126 or higher is diagnosed as diabetes. Fasting blood sugar is important because it reflects your body's basic ability to regulate glucose. If it's high even after a night of fasting, it could signal that your liver is overproducing glucose or that you have insulin resistance. But here's the catch: relying only on fasting blood sugar can miss hidden diabetes. In fact, about 25% of diabetes patients have normal fasting blood sugar but abnormally high post-meal blood sugar. That's why post-meal blood sugar can be even more critical. Post-meal blood sugar is measured 2 hours after eating. For normal individuals, it's below 140. 140 to 199 indicates prediabetes, and 200 or higher means diabetes. The scary thing about post-meal blood sugar is this: when we eat, blood sugar rises sharply, but in healthy people, insulin quickly kicks in to bring it back to normal within 2 hours. However, if you have diabetes or insulin resistance, this process fails, leaving blood sugar elevated. What's truly shocking is that vascular damage doesn't just occur. When blood sugar is high, it's worse during those blood sugar spikes when it rises and falls like a roller coaster. If these spikes repeat throughout most of our waking hours, it's like our blood vessels are constantly being whipped. This is why post-meal blood sugar management might be more important. A large-scale study in Japan found that people with high post-meal blood sugar had a much higher incidence of cardiovascular disease compared to those with only high fasting blood sugar. Additionally, research shows that severe post-meal blood sugar spikes cause more damage to endothelial cells in blood vessels. So, which is more important? The conclusion depends on individual circumstances. However, based on the latest medical research, both are crucial, but post-meal blood sugar management is increasingly emphasized. Why? Fasting blood sugar is mainly tied to the liver's glucose production, while post-meal blood sugar shows how your body handles glucose in daily life, and vascular damage and complications primarily occur during post-meal high blood sugar states. A key point to note is blood sugar variability. Fluctuations in blood sugar itself put significant stress on blood vessels. Even if the average blood sugar is the same, those with greater variability face higher risks. Here's another frightening story. Do any of you often feel sleepy or experience brain fog, a hazy, unfocused feeling after meals? That could be a strong sign that blood sugar spikes are affecting your brain. When blood sugar rises sharply, excessive insulin is released to manage it, putting tremendous stress on your body and brain. Also, feeling suddenly hungry or craving sweets 2 to 3 hours after eating could be due to reactive hypoglycemia following a blood sugar spike. So, how can you manage it? Regular checkups are essential. Beyond fasting blood sugar, consider getting tests for HbA1c, and if possible, post-meal blood sugar or a glucose tolerance test. Here are some lifestyle tips. When eating, start with vegetables, followed by protein, and finish with carbs to smooth out blood sugar spikes. This is called the meal sequence diet, and is recommended for diabetes patients. A light walk after meals is also highly effective. Muscles use glucose, helping to suppress blood sugar rises. Studies show that a 15-30-minute walk after eating can significantly reduce blood sugar spikes. Stress management is important too. The stress hormone cortisol raises blood sugar, so adequate sleep, regular exercise, and relaxation techniques like meditation or yoga can help. One final key point: blood sugar management isn't just about controlling a diabetes. It's a key to fixing your overall health system. Stable blood sugar makes weight management easier, improves focus, enhances skin health, boosts immunity, and even slows aging. In conclusion, both fasting and post-meal blood sugar are important, but for daily life and complication prevention, post-meal management might be more critical. Still, the best approach is keeping both within normal ranges. Why not start paying attention to blood sugar management for a healthier future? Small changes can make a big difference. If this video helped, please subscribe, like, and leave a comment with your thoughts. I'll be back with more useful health info next time. Thank you.